And concerns do you have about the coronavirus? Call us 1-888-416-8333. That's 1-888-416-8333.
The patient was detected and immediately put in isolation. Health officials are actively working to ensure that we identify everyone this person was in contact with in order to contain this virus.
Canadian health officials have been preparing for weeks for that deadly new strain of coronavirus to make the jump from China to Canada. Now, as you've been hearing in the news, a man in his 50s, traveling from Wuhan, the Chinese city at the heart of the outbreak, arrived in Toronto this week and fell ill. Tests have confirmed the patient is Canada's first presumptive positive case of coronavirus. The virus has now infected over 2,000 people worldwide, most in China, which reports over 50 deaths. As the death toll rises in China, Canada's health minister says the risk of coronavirus outbreak here remains low. Still, with China's health minister suggesting this fast-moving strain of coronavirus is spreading despite mass quarantines, you can't help but have lots of questions, maybe even fears. How contagious is it? Is it curable? Can it be contained? Infectious disease expert Dr. Susie Hoda and Stephen Hoffman, a professor of global health, will be here for the whole program to answer your questions about the coronavirus outbreak and discuss Canada's preparedness for pandemics. CBC's Asia correspondent Sasha Petrusik will join us too with the latest from China. It's a special coronavirus Q&A. What questions and concerns do you have about the coronavirus? We'd especially like to hear from you if you're in touch with friends or relatives impacted by this in China. You can send us a message on our Facebook live stream or Twitter at CheckupCBC. I'll be reading your comments throughout today's show. Or give us a call. The number again, 1-888-416-8333. I'm Duncan McHugh on CBC Radio 1 and online at CBC.ca. You're listening to Cross Country Checkup.
People did what they're supposed to do. As a result, the risk to Ontarians is still low. The system is operating as it should.
Before we get to Sasha, we want you to hear some of the voices from inside Wuhan, where more than 11 million people are currently living in lockdown.
Actually, having been out of my apartment for more than 24 hours, it's still dangerous outside.
The supermarket, a lot of people go to buy the fruit, the vegetable, and the meat to prepare. We think it's going to be not a short time to end this situation.
For some reason, they choose to hide this information from the public and tell us it is not serious at all.
Those were some voices from Wuhan. That tape came courtesy of the Washington Post. The coronavirus has now spread far beyond Wuhan to other parts of China and more than 10 countries, France, Japan, and Vietnam, to name a few. To get a sense of how the Chinese authorities and the general population is dealing with the growing crisis, I'm joined by Sasha Petrusik. He's our CBC Asia correspondent, and he joins us from Beijing. Hello, Sasha.
Hi, Duncan.
It's such a fast-moving story, Sasha. Can you describe the effect that the coronavirus is having in China right now?
Well, Duncan, it's really consumed this country. Just even over the past few days, you can tell from day to day how much more of a crisis atmosphere there is, not only in the government, but I think people are feeling it as well. The area in Wuhan that we keep focusing on is in fact in crisis, and we're talking about waiting rooms in hospitals where doctors are seeing one infected patient after another, surreal scenes in pharmacies where you have people in hazmat suits serving customers. Those kinds of things are going on, not just in Wuhan, but more and more in other parts of the country, in all the major cities, in all the regions, and more different areas, villages and provinces are in fact shutting their borders and closing roads, in some cases, digging up roads to stop people from coming in or going out. And that is just spreading over, as I say, over the past few days. Hour by hour, the the death rate and the number of people infected has been going up. And with that, all kinds of either planned or impromptu solutions that people are coming up with, which may or may not be helping.
We know that the flow of information in China is so often tightly controlled. Do you have a sense of how open the authorities are being about their concern over the spread of the virus, Sasha?
It's really difficult to tell until, later on we will be able to look back on all of this. Certainly they were heavily criticized in China and internationally for holding back on information about SARS. That was 17 years ago. Killed 800 people worldwide, and many believe that many people didn't have to die if China had acted more quickly and if it had released information more quickly, not only to the experts, but to its own population. There is evidence that in this case, officials in Wuhan and in Hubei province sat on information about this for weeks before letting it out, even to officials here in Beijing, that they did not warn the local population adequately, that in fact this virus didn't have to spread as far as it did, and wouldn't have had people known to take precautions earlier, weeks earlier. Since then, however, the national government has made a big show of being open and telling people, they say, everything there is to tell, with daily almost briefings and news conferences, with numbers being released sometimes hourly, and with other bits of information that we are getting. Today, for instance, there was a news conference where they talked about everything they say they know about this mysterious coronavirus, that they don't know much, but they know what the incubation period is now. It's very variable. They say up to 2 weeks. They also say that for instance, the virus can be passed along even during that incubation period. This is the kind of information that wasn't being released beforehand, and now they say they are giving it all out there. But I have to tell you that even people in China do not believe all of this and think that the situation is in fact much worse. Otherwise, the authorities wouldn't be preparing, as they seem to be, for a crisis that could go on for months.
And if it does evolve into a crisis, I mean, what kind of worries are there about resources in China to handle the disease and the kinds of investigations and treatment that are required?
Well, that's a very good question. I mean, China has a lot of resources. The question is, will those resources be put to the task? Will they be set aside in terms of the actual amounts? And will they be the right ones? In Wuhan itself, as an example, they are now building 2 brand new hospitals from the ground up in a matter of days. And these 2 hospitals will be able to handle something like 2,300 infected patients if necessary. And they will open their doors really at breakneck speed. I mean, and they're already taking shape. At the same time, hospitals in that same city don't have enough masks and latex gloves and not even doctors. Now, this is a country that should be able to provide those kinds of things as well. And so,
and my question, Sasha, I mean, I guess I wonder how cooperative are Chinese researchers being with their international counterparts if they admit that they don't know a whole lot? How are they reaching out to their global partners to try to get to the bottom of it?
Apparently they are. They have, in fact, shared information with the World Health Organization. The World Health Organization has commended China for this. And, in fact, Canada has received information from China as well, along with many other countries. So that part of it, apparently they are doing well, and they have been praised for it.
Sasha, it's always good to get updates from you. Thank you for checking in with us.
My pleasure, Duncan.
Sasha Petrusik is the CBC's Asia correspondent. We reached him in Beijing. This is a special coronavirus Q&A here on Checkup. Our expert panel is here in studio to take your questions. So we'd like to know what questions do you have about the coronavirus? You're listening to Cross Country Checkup on CBC Radio 1 and on Sirius XM Satellite Radio Channel 169. I'm Duncan McHugh. Call us at 1-888-416-8333, or you can email checkup@cbc.ca or join the conversation on social media. You can chat in real time on our Facebook live stream or share your thoughts on Twitter @CheckupCBC. We'll be reading your comments throughout today's show. Well, as you just heard Sasha say, until very recently, there were a lot of unknowns about this new strain of coronavirus. And now the race is on to find out as much as possible about how it operates and spreads. Christine Burak is the CBC's health reporter, and she joins us now. Hi.
Hello, Duncan.
What do we know? It's a newly identified virus, so what do we know?
Yeah, and it's only weeks into this outbreak. So to be perfectly honest, and I feel like maybe we don't hear health authorities say this enough, there's just a lot that we don't know. What we do know is that we're dealing with a coronavirus, and at its very basics, that means this virus belongs to a family of viruses that includes 6 others, including the common cold. So some as mild as the common cold, and as we heard Sasha say, it's also in the same family as SARS, which killed nearly 800 people 17 years ago. So right now, like SARS, it's understood that this virus appears to have jumped from an animal to a human being. Right now, it's believed that happened in a seafood market in Wuhan, China. And Wuhan is a city of 11 million people. So as we heard Sasha describe, the situation there is really tense. It has the most cases. And the original cluster of people who became sick all seem to have links to that seafood market. Another important point that we do know is the genome sequence of this coronavirus, which is kind of like a genetic barcode that identifies it. Chinese researchers released it weeks ago, allowing scientists around the world to develop tests for it, which are now being used in Canadian labs right across the country to catch cases of this coronavirus. And clearly those tests are working. Cases are being caught here in Canada and right around the world as we speak.
We heard the Chinese health minister say today that they were watching the spread in China. What have we learned about spread risks?
So we've been hearing from the World Health Organization, and they've been saying it's really still not clear how easily this virus spreads from person to person. And that's one of the reasons it decided not to declare this outbreak a public health emergency of international concern right now anyway. To become sick with the virus, it appears so far anyway, you need to be in close contact with an infected person. If that person is sneezing, coughing, spraying droplets around, and another person touches some of that fluid, touches their eyes, nose, and mouth, then they too can become infected. And that's why we're hearing from Canadian health officials saying they're now trying to get in touch with passengers who were sitting near Canada's first patient on an airplane. They're looking for people who were sitting within a 2-meter radius of that 50-year-old man who flew into Toronto. Now, we've also asked scientists and doctors about this, but because they're tracking down these contacts on the plane, how long does the virus live on hard surfaces? And so far, everybody that we've spoken to said, it's really just not clear right now. It could be hours, but it could be days. At this point, we just don't know. But so far, what we're seeing is this virus is spreading, as we heard from Sasha, inside China quite rapidly. We're not seeing it spreading quite as quickly in other countries where the virus has landed through air travel.
Christine, we're starting to get lots of questions pouring in on our social media feed. One that pops up here is who appears to be most vulnerable?
Well, it's interesting. We have heard that about 25% of the people who've shown up in Chinese hospitals with this new coronavirus are severely ill, and about 4% of them, 2 to 4%, are dying. By comparison, SARS killed about 20% of those who became infected. So at this stage, this virus seems to be less severe, but the World Health Organization is saying that many of the patients who've died from this new coronavirus had underlying health conditions or weakened immune systems for one reason or another. So while it may be affecting a range of ages, generally speaking, young children and the elderly tend to be most vulnerable.
And then a last question. Sasha talked about health officials, doctors, medical officials in China working toward trying to figure out more about this and working with the global community, obviously. What's the most urgent challenge facing scientists about figuring this out?
We've talked to quite a few people at this point, and I feel like one of the sentiments that's coming back to us is caring for patients, tracking down contacts of those patients. And that takes us back to transmissibility. Again, not knowing how easily this virus spreads from person to person and not knowing what this virus virus is really capable of. There are also teams around the world working on vaccines, but the fact is vaccines take time. You need approvals, clinical trials, so a vaccine is likely years away. In the meantime, I think this is becoming about getting accurate information out to people. We've been hearing today about the incubation periods we heard Sasha talking about. We put that to experts. Is it possible people are spreading this virus before they show symptoms? Infectious disease specialists we spoke with today say, yeah, that might be happening in a small way. It happens with most viruses, but they don't feel that there's cause for alarm, which underscores what we're hearing from Canadian health authorities, and that is that the risk is low. The situation is still evolving, and it's just worth keeping your eye on the information that is critical.
And nobody wants to be spreading misinformation, as we are seeing on social media right now.
Absolutely.
About the coronavirus. So thank you so much for sharing some of the hard facts of what we do know.
You're very welcome.
CBC National News health and science reporter Christine Barak. It's a special 2-hour call in today. Our experts are here. What questions and concerns do you have about the coronavirus? You're listening to Cross Country Checkup on CBC Radio 1. I'm Duncan McHugh. Call us at 1-888-416-8333. That's 1-888-416-8333. Well, over 50 deaths, hundreds have been infected. Millions of people in China are under lockdown, billions around the world concerned about its spread. That's the legacy so far of this new strain of coronavirus, which first emerged in the Chinese city of Wuhan in December. Just yesterday, health officials in Toronto confirmed the first case in Canada. For many Canadians, it echoes the 2002-2003 SARS outbreak. But how concerned should you be? What can you do about it? To help us out, we have two special guests in studio. Dr. Susie Hoda is Medical Director of Infection Prevention and Control and Infectious Disease Physician at the University Health Network in Toronto. And Professor Stephen Hoffman is Director of the Global Strategy Lab and Professor of Law, Health, and Political Science at York University. They're both here to answer any questions you may have about the coronavirus, outbreaks, government response, much more. You can ask them anything. Give us a call, 1-888-416-8333. It's 1-888-416-8333. Dr. Hoda, Professor Hoffman, thanks so much for joining us.
Thank you for having us.
I want to start with an obvious question for both of you. Stephen Hoffman, how concerned should Canadians be about the coronavirus right now?
Well, the situation is definitely still evolving. It's early days, but there's definitely no reason to panic. This is something, viruses like this are always spreading and evolving. And I think when we look at this one in particular, yes, there's many things we don't know, but also no reason to panic. One great thing is in the Canadian context, we have a fantastic public health system that is primed and ready. And indeed, from the initial response, we're saying they're doing a fantastic job.
And the first presumed case is at Sunnybrook Hospital. The man is in stable condition now. But I'll ask you the same question, Dr. Hoda. How concerned should Canadians be?
Well, I think that, it's unavoidable for people to get a little bit more nervous once you hear about it being right here in our own city, in Toronto and in our country. But, as Stephen has mentioned, panic is never a helpful response. This is a time for us who do this work to actually be focused on what we need to do to keep Canadians safe, to care for people who become sick with this infection, and to not get distracted by, misinformation, as it was mentioned earlier, and just emotional responses.
Dr. Hoda, can you go through some of the symptoms for us? I mean, what are we seeing with people that are coming down with this?
So fever is a common sign when people become infected, and early on it can just be sort of what we call malaise, so feeling generally unwell, fatigued, a cough or shortness of breath. Many of these individuals are coming down with a pneumonia, a viral pneumonia of sorts. There are some other symptoms that are very similar to the common cold, like runny nose and sore throat and such, that some people are reporting, but a little less frequently than those earlier symptoms I mentioned.
And then Stephen Hoffman, let me ask you, you're taking the broad high view of this. The World Health Organization on Thursday declined to declare an international health emergency. Was that the right call?
Well, the definition of a global health emergency is whether there's a risk to international public health and whether that risk requires an internationally coordinated response. So in practice, what that means is what WHO looks for is, has there been sustained spread of this virus in multiple countries? So we haven't seen that yet, right? So the sustained spread has only been in the Chinese context, not outside of China. But it looks like it has potential. So a lot of people are definitely thinking that maybe it could have been declared last Thursday. But it also makes sense that because we still don't have all the information, we haven't seen third and fourth degree spread as far as the information is available, that it made sense maybe to hold off, to wait on that declaration.
We're getting lots of questions on our social media feed, and our callers are already lining up to ask you questions. So I'm going to start bringing them into the conversation. You're going to be here with for the whole show, right? Vicki Clayton is on the line from Guelph, Ontario. Hi, Vicki. Welcome to Checkup.
Hi, thank you.
Thanks. You had a question, Vicki.
My question is about the tracking of this from the patient who came in from the Toronto airport. We were told that the patient was in fact showing symptoms at the airport on the plane, and that they're tracking people from the plane in a 2-meter radius, and then possibly those people who they've come in contact with. But my concern is this individual walked through the entire terminal. He would have gone to baggage claim, customs, the escalators, the washrooms, passenger pickup. And I'm wondering if that's being looked at, why we're not being told. Perhaps that would be too much and we would panic. Or is that not something that's being considered at this time?
Dr. Hoda, why don't you take a shot at that?
Sure. So, these kinds of viruses tend to require more close and really more sustained contact with somebody who's infected in order to cause a transmission event. So, it's usually larger respiratory droplets that are generated from when you cough or sneeze and you're infected with a virus like this that actually can only travel for about 2 meters or so before they kind of fall on surfaces. And so you have to be within that range and really in enough contact with an individual who's sick in order to pick up an infection. So that's why areas like, the terminal, the baggage claim, it's just, those are passing by kind of areas, and the chances of having picked anything up in that vicinity is quite low.
And Vicki, I wonder, it's a good question for Dr. Hoda. I wonder what's prompting the concern.
Well, I've been in a terminal and I've stood at customs when you're standing right in front of someone or right behind someone. You're within that 2-meter radius. And when you're at customs, you can be there for a while. And we all know how crowded baggage claims get. And people are coughing and sneezing. And we're all reaching for bags that might not be our own. It just seems like there's more potential than what your guest, no offense by any means, may be implying, but I understand that I'm not the expert, and it's just a concern for when I'm in there. I know I get sick all the time.
Sure. Yeah. No. I mean, you get pretty close quarters when you're on in an airplane. Vicki, thanks very much for the question. Dr. Hoda, you wanted to follow up?
Yeah, just one other comment. You're right that there are surfaces that we're all touching, and you can't control that so much. So another really important message is making sure that you clean your hands really, really frequently when you're in public areas, especially at this time of year when there are many respiratory viruses going around.
And there's a question that came in online that's related to this, perhaps more a security question for Stephen Hoffman. I mean, what more can be done at airports, which are essentially the first entry points for the virus? That's from Ria on Twitter.
Well, at this point, everything that probably should be done at airports is happening. So the most important thing is raising awareness for people that if they are returning from an affected area, and that if they do develop flu-like symptoms, that they should be in touch with public health officials and their healthcare provider. I think what's also clear is that there's been screening in the sense that when people access those electronic terminals, they get asked whether they were returning from affected area, do they have flu-like symptoms, another opportunity. And then a third is when they actually when they're talking to a border official. So in that respect, that would be exactly what we would probably want to see at this stage. What that does is it gives several opportunities to catch things, and it leaves people with information that if they later develop symptoms, they know exactly what to do. And indeed, that 3-step process, plus everything else that the Public Health Agency of Canada and local public health authorities are doing, has worked, because that's how we made sure that this first Canadian case actually was responded to quite well. The person got the information, they had a pamphlet, they knew that when symptoms got worse, they knew who to call and to let the emergency medical services know that this person had been in Wuhan and had flu-like symptoms.
And I'd like to follow up on that in a bit, and just kind of, if either one of you could take me behind the scenes at what may be happening at the hospitals right now and with public health officials, that would be great. But let me bring another caller in first. Keith Andrews is on the line from Toronto. Hi, Keith. Welcome to Checkup.
Hi, how you doing there?
Doing well. You had a question.
Yeah, well, I was just wondering, even the bins at the airport, like the airports are not clean at all, like ever, and the virus, they said that the flu virus could last 18 hours or something, and if the coronavirus has the same timeline, then would a lot of people be potentially infected because people empty their pockets out and everything, even Kleenexes and everything, and they say that that viruses can get through even like through layers of Kleenex.
Keith, good question. Thanks for that. And another question as well. I think it's related to Keith's. Came from Lisa Conway on Twitter. Do they know at this point how long the incubation period is, or if people are contagious before symptoms appear?
Sure. So I can probably start with that one. Let's start with Keith's question. So one of the things is we don't really know exactly how long the virus actually lasts on surfaces, and that probably varies somewhat depending on what the surface is made of anyways. We can presume that hours, possibly days, that virus could be there. You're absolutely right. We're not cleaning every single surface within an airport or any public area all the time. That's why it's so important to be washing your hands and cleaning your hands. Keep sanitizer with you, wash frequently, especially after you've been in public areas. And finally, if you avoid touching your face, that's another simple way that you can help yourself from not getting infected. So that's, really about the initial question. The other question about incubation periods, an interesting one. So, we'll probably hear more as more cases get reported and summarized. But right now, from the first publication of the earliest cases, it looked like about 3 to 6 days between when people get exposed and infected with this virus and when they show symptoms. However, we do also know that there have been some cases that have been as long as 14 days before symptoms develop. So all of our protocols are based upon the 14 days, which tends to be the upper limit of what we see with coronaviruses.
It begs the question. I mean, the first two calls about the airports and people wondering about going and flying in Canadian airports. Stephen Hoffman, I wonder. I mean, is it realistic to expect border officials to screen potential virus carriers at the border?
Well, border officials is only the third sort of step in this process that's currently in place. The first is asking people to self-declare based on information. Then they have a prompt at the electronic terminals. The border officials, then the third chance where people are prompted and reminded. Now, if people at that time do present with not feeling so well, the border officials then bring in representatives from the Public Health Agency of Canada who are on site to do further screening, temperature checks and such. And then if someone does have the symptoms and is a potential case, they're able to transfer that person to the closest hospital very quickly. So in that respect, the system was designed for things like this. And at least thus far with the first case, it seems to be working.
We're doing a special Q&A on the coronavirus, and I've got a panel here with me to answer your questions. Dr. Susie Hoda is a medical director of infection prevention and control and infectious diseases physician at the University Health Network, and Stephen Hoffman is the director of the Global Strategy Lab and professor of law, health, and political science at York University. If you have questions for them, give us a ring, 1-888-416-8333. Alison McGeer knows firsthand how devastating outbreaks of disease can be. She's also an infectious disease specialist at Toronto's Mount Sinai Hospital and a professor of public health at the University of Toronto. She was instrumental in Toronto's response to the 2002-2003 SARS epidemic. She contracted the SARS virus herself as well. Dr. McGeer joins us on the line now. Hello.
Good afternoon.
Can you take me back to when you contracted the SARS virus? What was it like?
Well, SARS is just a pneumonia, okay? There's nothing, just like this new virus, okay? There's nothing special or interesting or different about the infection it causes. But I think all of those of us who were involved in the management of the SARS outbreak in Toronto have maybe different memories, but memories of just what a difficult and challenging time that was. And it's been really lovely to see how well all of the pieces, both global, national, and local, have come together in this event, and how much better things are.
It was such a difficult period, and so I guess that's why people are hearkening back to it as they hear the stories about this new strain of coronavirus. How would you compare the level of preparedness now versus then back in 2002?
I think, if we start globally, I think the truth is that if anybody had told you before SARS happened, that a single person could export outbreaks from a city in China to 5 other places in the world that would result in large hospital-based outbreaks and people dying, you'd have been laughed out of the room. People just we hadn't sort of caught up with the globalization of the world and the possibility of evolving new viruses. But both SARS and the 2009 pandemic taught us a lot about the implications of the fact that we live in one world, and that's humans and other animals, and a great deal of work has gone into communications infrastructure, development of viral diagnostics, understanding the impact of globalization on how we do infection prevention in hospitals, and all of that is paying off.
And you contracted SARS yourself, so what has changed in terms of the way public, frontline nurses, for example, or doctors who may be treating this now, what's changed from now to back then to 2002?
So, I think a couple of things have changed. 20 years ago, we were just getting used to the fact that when somebody turned up in the emergency department with an illness, that you needed to ask where they had traveled to. So 40 years ago, we didn't do enough travel for that to be relevant. Now, it's actually relevant not just for communicable diseases, but because people can acquire diseases that from other countries that are not transmitted. So you can go to Mexico or Brazil and develop Zika virus infection or dengue fever, and then come home and present to the hospital here. So we've learned that when people present with acute illness that we need to ask where they have been, and that was not something that was common or necessary in the years before SARS. So that's one major change in how we view things. We had also, with the introduction of all the vaccines in the sort of 50s to 80s, we'd really gotten used to not having to worry about the transmission of infection in hospitals very much. And one of the things that the infection control community in Toronto discovered in about 6 months before SARS actually was that the teaching of student nurses about personal protective equipment and protecting themselves from infection in hospitals had been removed from the nursing curricula in all of our nursing schools. And that's just that, nursing curricula are sort of highly competitive for content. There's a lot of things you need to learn to be a good nurse. And people just perceived that infection prevention was not that important anymore, that other things were more important. And so that learning from SARS, that despite the fact that a lot of the time there's not much risk of transmission of infection in hospitals, that there still is a risk and that people need to know about it and know what to do about it, I think it's made a huge difference to how we take care of patients in our hospitals now.
And good to hear that there were lessons learned from that SARS outbreak. I guess the reason that people harken back to it is because it does seem that officials got caught off guard back then, that information was harder to come by in those early days. So to be clear, how concerned are you about this virus, this new strain of coronavirus?
So I think the concern about this new coronavirus is about still all of the uncertainties that we've just heard your guests talking about. The fact that we don't know whether the public health measures that are currently in place are going to be able to successfully contain it. The fact that we still don't know what the spectrum of illness is. There's still a great many unanswered questions. And as long as there are unanswered questions, then public health authorities are going to be worried about what the outcome of the outbreak is, which is a good thing. Okay, we want them to be worried. We want all of us to be working on it. But it's just going to take some time before we really know what the impact is going to be.
Dr. McGeer, thank you very much for helping us again know what we know, as they say.
Pleasure to talk to you. Bye-bye.
Dr. Alison McGeer is an infectious disease specialist at Toronto's Mount Sinai Hospital. We reached her in Toronto. You can email us your questions or comments to checkup@cbc.ca. Coming up, we're going to hear from CBC's tech reporter about the efforts to stop the spread of misinformation about the virus on social media in particular. Give us a call. What questions or concerns do you have about the coronavirus? You're listening to Cross Country Checkup on CBC Radio 1. I'm Duncan McHugh. Call us at 1-888-416-8333. That's 1-888-416-8333. Carol Town is on the line from Hamilton. Hi, Carol. Welcome to Checkup.
Hi, Duncan. Thank you. First of all, I wanted to say hello to Stephen Hoffman. Stephen, it's Carol, Alex's mom. So as soon as I heard your name, I wanted to call in. But I also have a specific question. The first thing I want to do just quickly is I just want to respond to Alison McGeer's points about hospitals and infection control. I've been in and out of hospitals here a lot in the last few years, and the one thing that has really changed and continues to change in hospitals is how crowded and dirty they are. So it's really great that we have a better system in place now to, detect, and like this one guy has gone into isolation. But I would wonder how many isolation units we will have in our hospitals. Here in Hamilton, we regularly have hospitals that are over capacity and people are in the halls, and I saw that last summer with my mother, which is not a busy time, or 2 summers ago. Anyway, the point is, I don't want to raise the alarm, but I think that we need to work. We need to step up infection control in our hospitals. Lots of people get sick when they go to hospital, whether it's C. difficile or something else. So I think we should not be complacent about that, and we should be trying to get more cleaners into the hospital during this kind of an outbreak.
And both Professor Hoffman and Dr. Hoda are nodding in agreement with you, Carol. You
Right.
had a question as well.
Yes. So my question really, I don't know that you can easily answer it, but I'm flying to India in a couple of weeks to New Delhi. And of course now I'm starting to think about being on a plane for 18 hours and, the spread of the virus. So I went and got a mask, but I don't know if the mask will be useful at all. So I wanted you to comment on masks, whether they're useful, whether we should get disposable ones, and that kind of thing. Also toilets on planes, and planes are pretty dirty places that don't have a lot of air. And even, people I know are flying right now between Toronto and Vancouver, and of course, there's lots of Chinese people who will be coming and going with the Spring Festival. So, not to be too extreme, but should we be not flying?
Okay, Carol, a good question. It sounds like you know Stephen previously, so why don't we put the question to Stephen?
Okay, great.
Great. Carol, great to hear your voice. So if it was me, I would definitely take the flight to India. I'd look forward to it and have a good time there, or if you're going there for work, to be productive.
No, for pleasure.
For pleasure. So then you should take the flights and have a good time. I think what's important now from a big picture perspective is that there are no travel bans or travel advisories. on the Canadian government's website from the Public Health Agency of Canada, there is a notice about if people are planning to go to affected areas to be extra precautious, washing hands, coughing into their elbows, keeping up to date on the latest developments. And indeed, Carol, you should do that too when you're in India to see as this develops. But I don't think there's any reason for worry. Definitely, if it was me, I would take the flight. I think when it comes to a virus like this, and Dr. Hoda will be able to go into more detail, what's clear is that it doesn't just spread throughout a whole plane. Indeed, actually, these really only spread within a couple of meters, because otherwise it just falls onto surfaces. So it's just not an extra risk.
Yeah, and what about masks, Dr. Hoda?
So masks can be helpful only in certain scenarios, but right now there's really not a role for everyone putting on a mask to protect themselves. So, in hospital settings, for example, we really do rely on our personal protective equipment. And we do want to make sure that people who are going into the room, if somebody who's suspected or confirmed to have an infection like this is wearing the appropriate type of personal protective equipment, which includes a mask. But, just going on a flight, there is no reason for you to have to do that at this point.
Good question, Carol. I hope you do have a good trip to India and enjoy your vacation. I want to pick up, you mentioned that there are no travel bans right now, Professor Stephen Hoffman. We got a question on Facebook from Tommy Warren, asks this: how bad does an infectious virus have to be before we close our airports and border crossings?
Well, typically travel bans just don't work. So it would have to, it's not going to be effective in this case in any event. What we do know is that based on past experience, when there has been travel bans or restrictions of various kinds, they actually cause more harm than good.
Why is that?
Well, it's because it encourages people to go underground and use unsecure ways of travel, making it more difficult for public health to actually track people. And if people do have the virus, to then do contact tracing. It's actually quite a big deal as well from the perspective of instilling trust or lack of trust in government authorities. I mean, right now, one of the concerns in China right now is with entire cities on lockdown. How much trust do those citizens have in their government that's keeping them in this area? And how effective is a quarantine of an entire city anyways? So what it does do is by undermining that trust, it is also undermining trust in public health authorities, making the entire response so much more difficult.
Carmen McIntyre is on the line from Toronto. Hi, Carmen. Welcome to Checkup.
Hi, thank you. I was calling to ask two questions. First of all, I'm a teacher, so I definitely want to know about best practices at a school where people are in close contact to each other in classrooms. And my second question is any specific suggestions for people that are immunosuppressed, like myself. I'm a transplant recipient, so I am immunosuppressed. So those are my two questions, and thank you for clearing up the misinformation out there, because I think that's extremely important.
Good question, Carmen, because of course any parent can tell you, my goodness, I mean, it just sounds like a common cold. It's cough, runny nose, those are the symptoms. So, yeah. I mean, obviously Carmen as a teacher is concerned about the little ones and the spread of it. So maybe we can tackle that one first and then ask about immunosuppressed.
Sure. So, I think in the setting where you work, it would be especially important to really adhere to those sort of basic infection control practices that I have already referred to. So, washing your hands and having your students wash their hands, especially if they're little ones, very frequently, making sure that people sneeze or cough into tissues if they're starting to get ill, and stay home and rest and not expose others potentially if they are ill. And then again, not touching your face very often. It's very challenging, especially with young children. But rest assured that if there was somebody who had the appropriate link to, the Wuhan area or one of the affected areas where this virus is present, if there was somebody who's symptomatic and in the school, public health would be following up with you on that. So, and on close contacts of that individual. So specific information would come at that time. In terms of being immune suppressed, there's really nothing additional or different that we have to advise in terms of practices. Just all of those basic infection control practices are important.
Stephen, you want to weigh in?
Well, I think the question's such a good one, and I think any teachers out there and or parents, I think this is a teachable moment. This is an opportunity to be training people and educating about the importance of hand washing, of coughing into elbows, of making sure that we adopt these good practices, good sleep.
And we've actually got a caller on the line who wants to talk just about that. Before I do that, we were talking about travel. And I just want to let our listeners know that Francois Philippe Champagne, our Canada's Minister of Foreign Affairs, just issued a statement in the past few minutes. I'll read it to you. We continue to advise Canadians to avoid non-essential travel to the province of Hubei, China, including the cities of Wuhan, Honggang, and Eju. I hope I got the pronunciation right there. Due to the heavy travel restrictions that have been imposed, Canadians should check the Government of Canada's travel advice and advisories for China before traveling. So that's a breaking statement from the Minister of Foreign Affairs, avoiding non-essential travel to the province of Hubei, China. But let's get back to hand washing. David Kattenberg is calling from Winnipeg, had a comment about that. Hi, David. Welcome to Checkup.
Yeah, I teach microbiology here in Winnipeg, and I was just telling my students the other day, if you're feeling anxious, and, even if you're not feeling anxious, the best thing to do to avoid getting infected with, the coronavirus or, the seasonal flu or pretty much anything else, common cold, which is often caused by coronaviruses, is just wash your hands. Wash your hands regularly in ordinary soap and hot water, right? Ordinary soap is fine. Like antimicrobial soap, right? Viruses are not alive. So, there are all kinds of compounds you find in antibacterial soap or antimicrobial soap that kill bacteria. They do nothing against viruses, which are not alive. Alcohol will get viruses, but ordinary soap and hot water, fairly frequently is the best, simplest, single best thing to do, because viruses, they don't, not being alive, they're out there in the environment, and maybe they're sitting on doorknobs or they're on the surfaces of smartphones or something, or on bench tops, but they don't survive for very long. But if you get them on your hands and then you pass your hands in front of your eyes, you rub your eyes, and bang, you're infected. It's one of the commonest routes of entry, right through the surface of the eyes.
And David,
you bring your hand to your mouth, and you're infected. So wash your hands regularly.
Good advice. Dr. Hoda is nodding vigorously. I know Dr. Brian Goldman was in last week as our Ask Me Anything guest. He was just getting over a cold, and I went to shake his hand at the end, and he kind of gave me a shoulder bump instead. Yeah. Are more people starting to do that kind of thing at this time of year?
Yeah, I would say, though, that's kind of my practice, actually, even in my clinic. It's a wave hello rather than a handshake. I think people understand that, but, it's such an important message, and the more people that can get it out there earlier in life, the more ingrained this becomes a habit of everybody. And, it's one of the frustrations of the job that I do that, even in healthcare settings, healthcare workers are not that great at performing hand hygiene or cleaning their hands when they should. And, these are ingrained habits that we have to try and tackle early in life. So,
David,
and what you were saying before, the guest who was just speaking, it just blew my mind that infection control these days, basic standard old-fashioned infection control methods in hospitals are kind of going out of by the wayside, and hand washing. A lot of health professionals and others in hospitals, they don't wash their hands, which is, I find, astonishing, amazing, but it is the simplest, cheapest, most straightforward way to stop transmission of infectious disease.
A good reminder, David, to wash our hands. I'll do so after the show, actually. Thanks very much for the call. Appreciate it.
More than welcome. Bye-bye.
It is such a simple reminder, but there's so much misinformation out there about how this is spreading, how this new strain of the coronavirus is spreading. Health experts around the globe are urging those looking for information on the coronavirus to stick to reputable sources, and not rely on social media. That's where misinformation about the illness is going, viral, pardon the pun. Thomas Daigle is CBC's tech reporter. He's been tracking all the misinformation out there. Hi, Thomas.
Hi, Duncan.
Tell me, I mean, what kind of things are you seeing about coronavirus spreading on social media?
Just fueled by a fear from a lot of users and even conspiracy theorists out there that China isn't being entirely forthcoming with the number of people who are sick or the number of people who've died or how this all started. There are a lot of theories out there and that are being shared, videos of people simply falling down in the street, people, conspiracy theorists, again, sort of presenting this as the truth, people finally getting to the truth and spreading that online despite no verification, despite, officials telling a very different story, even here in Canada.
Is there anything particularly egregious that you've seen, either posts or videos that are going viral right now?
Yeah, oftentimes it's those videos that have been going around of people just falling sort of face first on the ground in China, apparently stricken with this new coronavirus, or other rumors that are unproven, such as that 5G cellular technology in China has been causing coronavirus, or that nicotine wards off the coronavirus. Again, untrue, according to officials. Or another thing that has gone viral in North America on Facebook is this idea that an American patent was filed 5 years ago for a vaccine for this form of coronavirus.
Thomas, do we have any sense of where these posts are originating from? Is there one particular or large source of the material?
No, I think it's like many sources of misinformation online, and these are conspiracy theorists who are spreading this, often based on one nugget of truth, but expanding it into something that is completely untrue.
Professor Stephen Hoffman, I'd like to bring you in while Thomas is on the line. I mean, what kind of consequences do we see of this kind of misinformation in the real world?
Well, misinformation is definitely something that's a feature of outbreaks. This is something that we at public health are prepared to respond to. But the challenge is that sometimes these urban legends, misinformation can totally take up a life of its own.
Thomas, in terms of what are countries? I mean, are countries involved in trying to stop this at all, and particularly the flow of social media out of China?
Well, certainly in countries such as Canada, there's not much, a government or authorities can do. The internet is, cannot be controlled in that way. I would say that just since Friday, when I started reporting on this, compared to today, I've gone and looked up some of the same things that were being tweeted on Friday, and Twitter seems to have use their algorithm to take this back so that it doesn't show up if someone is just looking for information about coronavirus. This isn't one, this misinformation isn't one of the first things that becomes, visible on Twitter. Of course, the restrictions in China make it so Twitter and other Western social media sites aren't even available.
We're trying to offer as much helpful information as we can about the coronavirus, but I suppose we should offer some helpful information about getting information as well. So Thomas Daigle, I mean, what's the best way for social media users to make sure that the information they're seeing is accurate?
I think the best advice is always to double check the source that you're seeing information coming from online. If it's something that's particularly surprising, that is unlike what others are saying, double check where it's coming from and see if reputable news outlets and public health officials have said that, because public health officials have said, please do only believe fact-based information that's coming out.
Thomas Daigle, thank you very much for following that beat.
You're welcome.
Thomas Daigle is CBC's tech reporter. Coming up in the next hour, we'll hear from the president of the Ontario Nurses Association about how frontline workers are preparing to deal with more cases of the illness. Our focus today, what are your questions or concerns about the coronavirus? You're listening to Cross Country Checkup on CBC Radio 1. I'm Duncan McHugh. Call us at 1-888-416-8333. That's 1-888-416-8333. And this is a special Q&A about the coronavirus with the first presumptive case of the new coronavirus in Canada. And growing worries about its transmission. Cross Country Checkup is opening the phone lines to answer your questions. This is a special 2-hour call-in. You can ask the experts. Dr. Susie Hoda from the Toronto General Hospital Research Institute and York University Professor Stephen Hoffman are here to take your calls, answer your questions and concerns about the coronavirus. The suspected case of the coronavirus in Canada has many people focusing on the details of that patient's journey. The one who has arrived in Toronto, he flew into Toronto's Pearson Airport on Wednesday from Guangzhou, China, to gauge the mood of air travelers at Pearson. I'm joined now by CBC's Lorenda Redekop, who has been there for the last few hours. Hello, Lorenda.
Hi there, Duncan.
We're getting callers phoning in today asking about masks, and I wonder if you could just tell us that off the bat. How many people are wearing masks as they get off their flights today?
Well, that's pretty much the most striking thing that I noticed since I've been here, especially when it's a flight from some part of Asia. We see a lot of masks. And at first I was just seeing it on the passengers coming off those flights. But then I started also to see it on employees. So in some cases it was some flight attendants. Then I saw a man who's a baggage porter. So he had, one of those carts with a whole bunch of suitcases loaded up on it. And then also these two women who do cleaning here. And I chatted with them. Not on camera, but just had a little talk with them, and they said they just started wearing those masks and the rubber gloves just yesterday after the announcement came about Canada's first case. They said that they were here, but also behind security. So it's people who have just come off a flight and they don't know what situation that they could have been in, where they're coming from, and they just wanted to take extra precautions.
And so there are people that are starting to take precautions. Can you just give us a sense of what the mood is like at the airport?
Well, it's kind of hard to judge. In some cases, some people feel like it's the same, and they do feel confident in what Canadian officials are doing. People do mention SARS, and they feel that Canada has learned from what happened 17, 18 years ago. But then there are some people who are worried, and I also raised with some people about how with that flight that came in on Wednesday, that health officials are only going to be reaching out to the people who were seated very close to that man who has tested positive, presumptive positive. And they said, this is a long flight. We're looking at a flight that's around 15 hours. So, did that man go to the bathroom? Could he have sneezed on his way there or coughed on someone? And so they wonder whether everybody on that flight should be reached out to by officials and not just the people in that kind of 2-meter radius of him.
And I know you are gathering news today. It sounds like it's busy there at the airport. So I'm just going to squeeze one last question in for you, Lorenda. We're hearing news that the virus can spread before symptoms start to show. And so I wonder, how does that kind of thing square with some of the screening procedures at airports like Pearson?
Yeah, and here at Pearson and at Vancouver and Montreal, they are asking an extra question. They're asking if people were in Wuhan, kind of ground zero for this virus, and asking them if they have any symptoms. So I'm not sure what that really means in terms of the spread, but probably it will bring out a little more concern among people, because until now, what they thought is that basically if someone had symptoms, that's when they should be worried. And people just won't know quite what to do now. And health officials have said that previously, until someone had symptoms, that's when they were contagious. So we haven't been asking people about that just yet, but I will be doing that now later, as we're still going to be around here a while yet.
And you got a job to do, so I will let you go. Thank you very much for giving us the latest from Pearson.
Thanks so much.
CBC News reporter Lorenda Redekop at Toronto's Pearson Airport. Coming up in a bit, we're going to hear from a Chinese-Canadian mom in Toronto who's worried that Myths about the virus might lead to racism toward the Chinese community. But focusing more on that patient here in Toronto, as you probably heard, a man in his 50s traveling from Wuhan arrived in Toronto this week and fell ill. Tests have confirmed the patient is Canada's first presumptive positive case of coronavirus. He's now being treated in Toronto's Sunnybrook Hospital, and that's where we've caught up with CBC's senior reporter Ellen Morrow. She joins us now. Hello.
Hi, Duncan.
What do we know about the status of this case, Ellen?
Well, we received an update from Sunnybrook officials earlier today. They say this patient remains in stable condition. That's the same condition he was in last night when authorities first alerted the public to this case. We know this man's initial symptoms when he came to the hospital, transported by paramedics, were fever and respiratory symptoms. Officials said last night that overall this man has a relatively mild illness, but of course they're continuing to monitor him, and he remains in isolation here at Sunnybrook.
And how clear is the timeline of the patient's journey from leaving China to ending up in Sunnybrook?
Well, we do have a pretty good picture of that. We know that this man was in Wuhan, China this month, of course, the epicenter of this outbreak. He flew from Wuhan to Guangzhou, China, then flew from Guangzhou to Toronto, landing in the city at Pearson on January 22nd, which was this past Wednesday. Now, we learned today that the man was showing symptoms of this illness on that flight to Toronto. He became more sick after going home on Wednesday after landing. His family alerted the authorities as he became more ill. They called 911 and he was transported here to Sunnybrook on Thursday evening.
And then what are you hearing from the hospital about exposure and transmission risk?
Well, hospital and public health officials are stressing that the risk is low. They say this man had limited contact with other members of the public once arriving in Toronto. They say he went home in a private vehicle and was in hospital the next day, and that his family members have now put themselves in self-isolation. But one important fact that we learned today, as I mentioned, is that this man was symptomatic on his flight from China. That does mean there is a level of concern, albeit small, for those who were close to him on that plane within a 2-meter radius, authorities say, or around 3 rows from his actual seat on the plane. And authorities are now investigating and trying to get in contact with those people who were close to this man on that plane. But still, again, they stress that the risk to the public, Duncan, is low.
We're going to have Barbara Yaffe, who is the Ontario Associate Chief Medical Officer of Health, on in a few minutes. So it's we'll get the latest from her as well. But it's good to hear from Sunnybrook. Ellen, thank you very much.
Thank you.
CBC senior reporter Ellen Morrow at Toronto's Sunnybrook Hospital. Let's get back to the lines. Michael Chapman is calling from Vancouver. Hi, Michael. Welcome to Checkup.
Good afternoon.
You had a question for our panel.
Well, my concern is I was a customs officer at Pearson International Airport during the SARS outbreak in 2003. And as the co-chair of the Occupational Safety and Health Committee for the airport and the 400 customs officers, I asked for a mask and gloves to protect myself and to protect Canadians, and was refused that by management because they were concerned about the image that would send to the public. As it turned out, we know that 33 people died in Toronto because of that disease, and that was a woman that came through customs who brought the disease into the city. So now when I hear public officials downplaying the severity of this outbreak and saying this sounds even worse than SARS now because apparently it's transmissible or it's contagious before symptoms, I'm really scared.
Why are you scared, Michael? Because, I mean, you may have heard earlier we had callers on that said we've learned lessons from SARS and the flow of information has changed quite a bit. So what scares you?
Well, what scares me is the fact that what we did learn from SARS is that the virus could live for 48 hours on a surface, which was unheard of previously. So if this is worse than SARS because you don't necessarily have to show symptoms to be spreading it, I would say that anyone that was on that plane should be immediately contacted, and their families and the people that they're going around should be immediately contacted. Risk management is always done by assessing the highest risk until it is known. Then you work your way down. This idea of starting at a low risk is just propaganda. Why would we not err on the side of caution? I know that some people might be, output by having to self-quarantine for a few days, but what's the other option?
And Michael, we've got a panel here, Dr. Susie Hoda and Stephen Hoffman, who are trying to help us make sure we've got all the correct information. Dr. Hoda, do you want to? Michael's obviously expressing some concerns there, given what he experienced as a customs officer at Pearson during SARS. So what do you have think of what he has to say?
Yeah, no, I can fully appreciate your concerns, Michael. You mentioned a lot of different things that are really important to touch on. I do want to first comment on one thing that you said and that was previously mentioned about the possibility of this spreading in people who don't have symptoms yet. So transmitting infection if you're infected, but you're not showing symptoms yet. And that really is not entirely clear to me yet. I know that there have been reports in the media suggesting this, and also from health officials in China. But where that conclusion is being derived from is not really clear to me. And so sometimes...
why not err on the side of caution? This is a lethal disease. Why would we ever, why take a chance?
So as far as we know right now, what we're seeing at the moment suggests that, first of all, the mortality in this illness is lower than what we experienced with SARS. So I'm very careful about using language like deadly viruses and, lethal viruses. I'm not trying to minimize the impact of it, but I do want to point out that is an important thing for us to understand. Now, you do make good points about what we call the precautionary principle. And when we're dealing with the unknown, we often will use heightened levels of precautions to protect people, just because, we just can't afford to make a mistake on that. But that doesn't mean that we should apply measures that aren't proven. And at this point in time, there really isn't any evidence that having everybody wear masks and gloves to protect themselves is actually going to make a difference. So,
I'm not suggesting masks and gloves for everyone. I'm suggesting that for people in the customs environment who are doing close personal contact. But my concern is when public health officials say it's a low risk, they don't worry about it, which they've been saying, and it's like, why not err on the side of caution?
And
really
Professor
not that of a thing.
Professor Stephen Hoffman teaches global health, law, political science at York University. You had some thoughts as well about what Michael's saying.
Michael, I think the question is it's a very good one. I would say that public health officials are actually erring on the side of caution right now. The reality is that the risk to the public in Canada is low. But just because it's low, that doesn't mean that public health officials aren't taking it extremely seriously, mobilizing, alerting, being out there on the call all the time in order to make sure that we in Canada are safe. So in that respect, I think that, yes, the public messaging is that the risk to the public is low, because it is from a epidemiologic and public health perspective, but we are also seeing a huge mobilization in the public health community, and we're seeing that mobilization starting to work.
Michael, it's good to get your thoughts.
I thank you for that, but I think that 2 meters seating from the passengers is a little bit too low. Then we should just maybe tell everyone on that plane that they should be very, very careful.
Thank you. And as a customs officer who was at Pearson during SARS, I appreciate your comments. I understand where they're coming from. So thank you very much for your call. Dr. Paul Colfort is on the line from Toronto. Hi, Dr. Paul. How are you?
I'm good. How are you guys?
Good. Did you have a question or comment, I guess, about the coronavirus?
Yeah, I do. I'm a family physician and work in Scarborough. And during SARS was part of the team in the SARS assessment unit at the Scarborough Hospital, which was ground zero. And my comments relate to community family doctors, in particular, the only physician, and I don't wish to create alarm and compare SARS to this problem, although there are similarities. The only physician who passed was a colleague of mine who worked in our team during SARS. And the infection put 4 of those doctors and some of the patients into SARS treatment. They came down with SARS. One of them passed from it. And at the time during SARS and the subsequent sort of post-biopsy of the event, which took place through Carolyn Bennett's work with the ministry at the federal level, and also the post-mortem biopsies that happened of the event at the Ontario College of Family Physicians and the College of Family Physicians of Canada, indicated that information, and with all respect given to the SARS teams at the time, information to the community family frontline providers was slow to come. And it wasn't just slow to come to them. By that very nature, it was slow to come to their patients that they treat in their offices. And that's where I'm going with this. At the present time, we have not received any information specifically geared to family physicians in the community or nurse practitioners and others, health providers, frontline health providers. We didn't during SARS. We haven't now. In fact, when we called during SARS to tidy up the office and disinfect the office of the infected 4 colleagues, we were told from public health that we should do that ourselves, that there was nothing that they could do to help, which we did. And I would say that we need to make sure that it's not just airports, it's not just hospitals. I've heard, those are the only 2 words I've heard in terms of the last little while. We just had another conference call at the Scarborough Hospital for this virus. It was like deja vu, eerily all over again. And there wasn't any mention of that. And the second point is we can't get supplies. So I've just left the office now, the clinic. We have a refugee clinic in Scarborough, and we're on high alert because of the nature of the patients we serve. And many of our patients come from China and that area of the world but of course it's out there now. And we don't have access to supplies. We ordered at the beginning, or I guess early this past week, masks, hairnets, face masks for our staff should they be in contact. We have screening procedures in place, much like we did with the SARS assessment unit. We're not going overboard with this situation, but we're putting in place precautions, and we can't get supplies. The suppliers are telling us that they've gone to the hospitals, they've gone elsewhere. So that's one issue I wanted to
And Dr. Colford, I'm going to put that directly to Barbara Yaffe when she joins us a little later on the program. But can I ask you this? I mean, the end result, if we look back at what we learned from 2002 and the SARS crisis 2003, was that healthcare workers in small clinics like what you're mentioning there, but also in the hospitals, were kind of unprepared when it came to taking the precautions that were necessary in terms of the spread of the disease. And so there were some really unfortunate incidents like your colleague that you were telling us that passed away. So are you as worried about healthcare workers being unprepared in a clinic like the one you're talking about?
It's a great question. I do believe that, I think your guests have been talking about this, that we are better prepared because of what we learned in SARS, and I think there's no question about that. But I'm just wondering how much it's being applied. I talked to a few colleagues and asked them. I talked to our Central East LHIN, which is still operational, local health network. What recommendations do you have? And they said, what do you have? And I said, well, we have these 10 recommendations, roughly 10 things, from hand washing, et cetera, and masking and index casing. And they said, oh, could you send them to us? So, I think that even though, and I think a lot of the memory is gone. A lot of the SARS memory is gone in the sense of, you want to call it healthcare memory. That was 17 years ago. And the people who were on those front lines, many of them are gone off and not in those positions anymore. So we're seeing a lot of folks who've not experienced this before in positions of managing infection control, which is wonderful, highly qualified. I'm not suggesting anything like that. But that memory, for me, at least, personally, has been extraordinarily valuable because we have young and we have middle-aged and some older staff in our refugee center, and they're sort of looking to us to what to do. So I don't want to drag on too long, but
no, it's a valuable perspective, Dr. Colford, and I thank you for raising it. Thanks very much for calling.
Sure. Good luck.
Let's shift for a second to Canada's Chinese community, because, of course, for them also, today's topic brings up a lot of mixed emotions. Lunar New Year celebrations are continuing this weekend. Questions remain about the coronavirus in China. On top of that, some fear that the misinformation around the disease could take on racist overtones that single out their community. Terry Chu is a mom and an activist in Toronto. That's where we've reached her. Hello, Terry.
Hello, how are you?
I'm doing well. On Twitter yesterday, you wrote this. Let me read it to our listeners. In my Chinese moms chat group, we discussed how to brace ourselves and the kids for the inevitable wave of racism coming our way as this unfolds. Can you tell us what kind of concerns you've heard from other families?
Well, primarily we were discussing how the community dealt with the backlash to SARS, how that impacted us, and we were just sort of bracing ourselves that this will likely happen again. Most of us were much younger then. We weren't moms yet. And now that we are, we're sort of concerned about what our kids may or may not experience, be it in the classroom or, at school. We are a little concerned about the impact on them, but also to the broader community as a whole.
When you say backlash during SARS, I mean, what did you experience? What do you remember from that time?
We all sort of had different memories about what happened. And obviously, whether you're in a big city or in a smaller center, it impacts you very differently. My family owned a Chinese restaurant in London, Ontario back then. And I remember it was just a period of being dead quiet. And it's not like we had a lot of travel to and from Hong Kong at the time. It was just the fear. It really impacted the small businesses.
When you say dead quiet, do you mean people not coming to the restaurant?
Absolutely. And obviously, in the immigrant communities, they have a lot of entrepreneurs because as an immigrant, it's hard to get hired in whatever profession you may or may not have come from before. So people go into their own small businesses and they're absolutely dependent on people coming out, right? And so when you have a thing like this, it really impacts people's incomes, people's livelihoods. It has a huge effect.
You mentioned that you've been talking about this with a moms group, a Chinese moms group. What are they saying to you about their concerns about kids going to school this week?
Memories. One said she used to teach piano, and as she waited for her ride to pick her up, there were a bunch of boys in a car that drove by and screamed SARS at her. Mm. There are things like people would just see you and walk to the other side of the street, and that's a little more subtle. But we all experienced that subtle bit of racism in different ways. And even now with what's happening with the coronavirus, I don't believe that we know exactly where it comes from. And people are already saying, oh, well, that's because you Chinese people eat bats and you eat whatever, right? And it's not really fair for the kids to have to listen to this either. They don't understand. Don't forget that we've been here as a community for a very long time. Many of us don't even speak the language anymore. We don't really identify with anything in China. None of us can pretty much point to Wuhan on a map. And yet people are looking at us and saying, oh, yeah, well, it's because you people eat bats. And it does hurt. It stings a little because, you look at us and say, well, what did we do wrong? And the racist undertones of that is enormous. When you think about how the West eats animals as well. They're saying, well, you can't go and eat wild animals, but yet it's okay to cage them and put them into pens. And as a result of Western animal practices, we've had mad cow, we have antibiotic resistance, right? And so there's a huge blind spot when it comes to, oh, your culture caused this, right? And they don't look at the diseases that their own cultural practices may have caused.
And, of course, the other thing that's going on right now at this time of the year, you've been at home, you're preparing for the Lunar New Year.
Yes.
So how's the news about this virus impacted the mood this year?
Oh, well, it's put a damper definitely on things. Some friends of mine this morning, they said they went to dim sum and it was quite quiet, which is highly unusual. Today's the second day of our New Year. Normally people would be out. For the next 2 weeks, it should be really busy. And apparently there's been quite the damper on festivities already. It impacts us because there is fear. There definitely is fear. I don't want to say it's unfounded because there's risk to everything, but just to put it all into perspective, if I'm not mistaken, I think 40-odd people died from SARS, and I definitely don't want to downplay how serious it is. But also, 40-odd people died from vehicular accidents, pedestrians. I believe 40-odd pedestrians got mowed down by cars in Toronto alone last year. And if only we treated that kind of fatality the same way that we treat this, I think we would be much better off as a society.
Terry Chu, thank you very much for joining us and sharing your perspective. Shin Ni An Ho.
Thank you for having me. Have a great new year.
Terry Chu is a mom and activist based in Toronto. Professor Stephen Hoffman, you had some thoughts about what Terry had to say.
I think Terry's concerns are valid and really important. I think it really highlights the human cost of these kind of outbreaks. As a public health professional, I'm less worried about the virus itself than I am about the consequences of our reaction to it, both in terms of fear as well as in terms of all the things that we're not going to be able to do because of our hyper-focus on this virus. I think keeping it in perspective is really important. For example, today is World Leprosy Day. Every year, 200,000 people get leprosy. And it's a staggering number, and it's just one example of a disease. And when we think of, okay, this is something that thus far has affected 2,000 people, yes, 2,000, that's a number, but in the grand scheme of things, I'm much more worried about everything else and the reaction, the consequences of fear, more worried about that than the consequences of this virus at this time.
I'm Duncan McHugh. You're listening to Cross Country Checkup on CBC Radio and on our Facebook live stream, of course, with the first presumptive case of the new coronavirus in Canada. We are opening up the lines on Cross Country Checkup to talk about it. Yesterday, public health officials in Ontario confirmed Toronto is dealing with Canada's first presumptive case of the coronavirus. The 50-year-old patient has just arrived in Canada from Wuhan and is now in isolation at Sunnybrook Hospital. Barbara Yaffe is the Ontario Associate Chief Medical Officer of Health and was at that press conference yesterday giving us the details. She was one of the chief investigators and managers of the 2002-2003 SARS outbreak and then the H1N1 pandemic influenza response in 2010, and she joins us now. Hello.
Hello.
Could you give us the latest update on that patient first before we get going with questions?
The patient is stable. He remains in negative pressure room at Sunnybrook Hospital and clinically doing well. And all the healthcare workers that are treating him are in full protective gear. So,
can you walk us through what kind of steps are taken immediately after you find out that there was a confirmed case of coronavirus?
Well, let me step back. First, in terms of who would get tested, we have made novel coronavirus reportable by physicians, hospitals, and labs and other healthcare facilities. So if somebody shows up or calls and says, I was in, at this point we're looking at Wuhan and the province that it's in. If they were there within 14 days and they've developed respiratory symptoms, fever, cough, shortness of breath, they are considered what we call a person under investigation. We facilitate them getting lab testing by the provincial public health lab. That's testing throat swab and a nasal pharyngeal swab. And we've had a number of those already, and they've come back usually with something else. They've got influenza, they've got other viruses that are, of course, we're in flu season. And the result takes about 24 hours to come back. So when we received the result yesterday, that this one patient was presumptive confirmed positive, immediately we worked together with the hospital, the clinical people taking care of the patient, making sure, first of all, that he's being managed appropriately under protective equipment and isolation. And then we work with the local public health unit, which in this case is Toronto Public Health, to identify who may have been exposed to infection while this person was ill. So it's a collaborative effort between different, and we also work with the Public Health Agency of Canada as well, because they have to report up to the WHO.
Barbara Yaffe, we're hearing that hospitals are ready to deal with more patients if this continues to spread. But we had a caller on a doctor who works in a smaller local clinic earlier, who said, listen, my health staff can't get supplies. They don't have enough masks. They don't have enough information, concerned about the level of information that is getting to his staff at a refugee center. What do you say to when you hear that kind of stuff not filtering down beyond the major hospitals like Sunnybrook?
Well, I think communication is critical, and we prioritized, obviously, communication with the acute care hospitals, but we are working on communication for primary care, long-term care, other sectors, and we've worked already with the paramedics. So in the meantime, the ministry has information on our website that's updated daily at 10:30 in the morning that has some very good information. And if people have questions, they could call their local health unit as well. I do understand.
If I could interrupt, though, I mean, this is a doctor who's working in a local clinic who lost a colleague during SARS, and you can imagine his concern when I mean, it's one thing to say that there's a website out there that they can get information on, but if he doesn't feel confident that his staff are getting the information that they need, that they're not going to be prepared, shouldn't that be a concern?
It is a concern, and I think primary care is one of our top priorities. We're working on guidelines as we speak. We have had several calls with stakeholder groups, which include the Ontario Medical Association and the Nursing Association and so on. And, they just have, at this point, he has to use common sense. And if a patient calls in and says that they have been traveling to Wuhan, China, and they have symptoms, they probably should be referred to a hospital. And the hospital should be alerted.
Barbara Yaffe, I recognize this is a very busy time, so I do appreciate you joining us here on Checkup. I'm going to ask you one last question. Can you just give us, I mean, you were there also during SARS, during H1N1. Can you give us a sense right now about how you're feeling about how this compares to what you saw during those particular times?
Yes, I certainly was there. I think much improved compared to SARS. We have learned so much from SARS. The system is much better prepared. The hospitals are using infection prevention and control. They have good supplies. They have trained staff. We are getting much better communication between different levels of government. I think that we are just, I think the other thing is Public Health Ontario now exists, which it didn't exist, and we have a very good laboratory. So this virus was identified very quickly. In SARS, it took about 3 months till we even knew what was going on, and it started with cases in a hospital. Here, we know what's going on. The virus has been genetically identified, and we already have a test for it. And this is within a few weeks. So, and that's very key, to be able to actually test and diagnose, does this person actually have it or not, is like really key. And that was a huge barrier in SARS.
I know this is a critical time, and there's a lot of demands on your time, so I thank you for sharing the information with us.
Oh, you're very welcome.
Barbara Yaffe is the Ontario Associate Chief Medical Officer of Health. You're listening to Cross Country Checkup on CBC Radio 1. I'm Duncan McHugh. Call us at 1-888-416-8333. That's 1-888-416-8333. We are here to try to answer your questions if you've got them. So give us a call, 1-888-416-8333. Questions or concerns about the new strain of coronavirus. Dr. Susie Hoda is here, an infectious disease investigator at the University Health Network, and Professor Stephen Hoffman, who is a global health expert at York University. David Witzel is on the line from Porcupine, Ontario. Hi, David. Welcome to Checkup.
Well, thank you very much for inviting me. I'm curious about this coronavirus. I haven't heard what the symptoms are, for one thing. And up here, I don't know what it's like about other hospitals, but it was even printed in the newspaper that people with the flu, which we've got a couple of different kinds of flu that have been going on for about the last month or so, that they don't want people coming up to the hospital with the flu. Well, if somebody has a coronavirus and thinks it's the flu or whatever, and can't go up to the hospital because they say they can't, the virus will spread. Now, the thing about it is also, people who have the coronavirus, they open doors. The doors have ridges or handles, and if someone with corona opens the door, many others open the same door after them, and what happens then? Now also, and I've been to China before, now also when somebody is on a vacation or somebody's whatever, and they send, say, a postcard or a letter, and they lick the stamp, well, that gets delivered, or they send a parcel from there or from a certain area in China to another area in China, which gets sent to Canada or wherever. That has the potential of having the virus on it. And when a person licks a stamp, that...
David, I'm going to jump in because you just did what we journalists call, you asked a triple-barreled question there, I think. So let's sure. Try to. I'm going to let you go. Thank you very much for that. I'm going to put your questions to Dr. Hoda, I think, because let me ask. There's a couple good ones there that David had. Not to make light of the questions that he was asking, but he asked about the stamps from China. We got the same thing from Jennifer Toop on Twitter. Should we be concerned with packages and mail imported into Canada from China? How long is the virus considered viable away from a living organism?
Mm-hmm. So interesting concept. Yes, we do lick stamps to put them on or envelopes to close them, but generally we don't lick them to open them. So you have to think about how we actually get infected. And so, in order for a virus to be transmitted, it has to first last through the whole transportation from one country to another, and likely it wouldn't remain viable in that kind of sense over that period of time for the transportation. And then when you open it, you'd have to have contaminated hands that you would then touch your face. And so it all comes back down to the same message that I've been saying, which is we need to wash our hands really well all the time, and try avoid touching our faces in case there is something residual there. But the risk of that kind of transmission event is incredibly low. So interesting thought, but low risk.
David also said, and it bears repeating, but what are the symptoms? And I think his question was, how does it relate to? It seems like the symptoms are are the same as the common flu. So how do medical professionals distinguish?
Certainly the symptoms overlap a lot with different respiratory viruses that we see that are totally kind of routine, I guess, in our system now. Generally, people with this infection have fevers. They feel overall unwell. They can have respiratory symptoms like cough or shortness of breath. And then things like muscle aches, et cetera. You're right that overlaps with the flu and other types of viruses that we see. But, the key thing here is having had exposure to an area where this virus is transmitting. So, those are the questions that are asked when people seek medical attention, in order to distinguish one from the other as best as possible.
And related to that flu question, I want to read you something that we just got in from Twitter. Sandra Burton asked this question. Does the flu shot provide any protection against the coronavirus?
At this point in time, there's no evidence that the flu shot would change any risk related to the coronavirus. There are different viruses. They will stimulate different types of immune responses for protection.
There's another aspect that we haven't explored yet in this program. The Wildlife Conservation Society is weighing in now, saying that wildlife markets, such as the one in Wuhan, should be shut down everywhere, not just in China. In response to the outbreak, Chinese authorities announced a temporary ban on the trade of wild animals. To weigh in on these questions, we're joined by Kerry Bowman. He's an environmentalist and bioethicist at the University of Toronto, and that's where we've reached him. Hello.
Hello.
Kerry, you've visited the market in Wuhan, others around the globe. Can you describe what it was like there?
Yeah, it's the first thing that would often strike a person is just, the incredible volume of animals. When I was in Wuhan, we counted 56 species packed into a market. So this would be a combination between wild animal species and domestic. So domestic meaning chickens, pigs, those types of things that many of us are used to. And then a lot of species that, bamboo rats, salamanders, crocodiles, turtles, civets, porcupines, a lot of Asian species that perhaps a lot of listeners might not be familiar with, all crammed together. And, it was hot. It was summer. So it wasn't just recently. It was a little while ago. And but same market. And, they were using high-pressured hoses and spraying these tiny cages. These animals were clearly stressed and very sick. Some in fact, had died. Some were close to death. And, you had feces and urine just flowing from one cage to another. So, what you've got there is an incubator for all kinds of things. And, this is not China alone. There is wildlife consumption all over the world, certainly within Africa, particularly Central Africa, Latin America, and Canadians, of course, eat wildlife as well. We don't have the market. But it's a complex problem. And, as much as, I feel a little guilty almost talking about this at this time because, the first priority really has to be to the safety and well-being of the many people all over the world right now to make sure that this outbreak doesn't go any further than it has to.
Absolutely. We are obviously very concerned about how it's affecting humans, but the virus is spread from animal to animal and has jumped from animal to human transmission.
Yeah,
so
all indications are that has happened. And, there's emerging theories, and likely this would be a recombination between species. And, theories emerge and theories decline as to which species it is, and, we won't know for some time. But let me say this, we have done so much, not just in Canada, but all over the world in terms of readiness for these outbreaks. But boy, have we failed on a global health level in terms of wildlife markets.
These are animals. So you named off a bunch of animals there. Whether it's wolves or foxes or rats or peacocks. They're destined for the dinner plate. Is that right?
That's exactly right.
And so what do you think of the call from the Wildlife Conservation Society to shut the markets down?
I think, first of all, in China, it makes a lot of sense. First of all, the spillover has already happened. So, it's probably not going to have an immediate effect. The spillover meaning the recombination and the fact that it's had transmission to humans. That has already happened. I think it's a good one. The question was whether it'll be long-term or not. A global ban, I'm not necessarily against it per se, but it would take some very careful fine-tuning because, particularly in Africa, you have to consider food security. There are many people that their only form of protein is wild animals, particularly within the Congo Basin. And there's a lot of cultural practices associated with this. So I'm not saying we shouldn't do it, and I think we really have to move towards it. But let's be clear, China banned all of this in 2003 after the SARS outbreak, and slowly, through a combination of legal and illegal, it's come back. And within China, I used to live in Hong Kong, and I've been in China several times. And within China, it's quite common. And now it's electronic. There's online ways of buying wild animals as well. So it is happening all over the world. The Ebola outbreak is also of animal zoonotic origin. Even HIV was. And, where we've really, really fallen down is getting to the source of this. We've got a crashing biodiversity crisis. Animals are being wiped off the face of the earth. And, part of it is a lot of things, including these levels of consumption. And then even species in the wild have less and less territory, and species are being forced closer and closer together. There's some emerging data that crashing biodiversity is very bad for human health. And these are kind of the root causes that I think are going to need some really careful attention to protect us all in the future.
Kerry Bowman, we're used to hearing from you and your expertise on bioethics. But I wonder, can I just ask you to weigh in for a second on wildlife policies and whether or not they should be, factored into public health concerns when it comes to the spread of disease?
Well, I think for too long we have made this cataclysmic mistake of separating human health from environmental and animal health. And there's growing data, not just ethical, but biological, that this has been a huge mistake. The environmental crisis is very much tied to all of our well-beings. And, if you look at China, it has had some really, really major environmental degradation. It's also one of the leaders in the world for green technology. China's doing a lot. But it's not so much, some people would argue this is no time to be putting animals before people, but these things are woven together. And there's a kind of a planetary health that we're really, really ignoring and at our peril.
Carrie Bowman, you've given us some food for thought. Thanks very much for phoning.
You're very welcome. Thank you.
Carrie Bowman is an environmentalist and bioethicist at the University of Toronto, and we reached him in Toronto. Lots of questions still coming in online. So if I could, Professor Hoffman, maybe this is one for you. Where was it now? I'm trying to keep track of myself here. No, I lost it. Does the Somia Loves on Twitter, does the Canadian government follow up and check on patients who have just returned from affected areas, or is it a wait until they show symptoms thing?
In Canada, it's really dependent on people reporting symptoms. I mean, certainly when people, if they are, for example, on that flight where there was that presumptively confirmed case, then of course, if they're within the 2 meters, they will be contacted by public health authorities, by the local public health authority. But no, I think what people need to know is that if they've returned from an affected place, they don't have symptoms, they don't have to worry in that respect. I mean, I think that public health will be contacting those who are at greatest risk, but otherwise, it's okay.
Dr. Hoda.
Just wanted to make a quick comment that's really key, the self-monitoring piece. And one of the things that we want to avoid happening is a worried well coming and overwhelming the emergency departments with questions when they're feeling completely well, but are just worried because they had the exposure. It takes the two together to be concerned that you have this infection, the symptoms as well as the appropriate exposure history.
Here's the question I was going to ask you, Stephen Hoffman. I lost it there in all the vast numbers of questions coming in here. Wendy Luke Brody on Facebook asked this: what happens when the virus reaches developing countries who don't have the resources to fight this virus?
Well, that's a bigger worry, right? Because so we in Canada are so lucky. We have a fantastic public health system, one that's vastly improved from, over the past couple decades from the harsh lessons we learned during SARS. But you're right, not every country in the world has the same public health capacity like we do. And so, yeah, that is an ongoing concern. That's personally where more of my concern is than in the Canadian context. But the good news is that the World Health Organization is on the ground in China, is already supporting and working with countries around the world that are at greatest risk. So, for example, we know that there's quite a lot of travel between China and Central Africa. I know that WHO is already in touch with ministries of health and public health authorities in countries there. And the hope is that this will be able to be contained if it does indeed reach those countries. But the concern is one that certainly I have more concern over that than anything that would happen in Canada.
Stephen Hoffman is the Director of Global Strategy Lab at York University. He's here with me in studio answering your questions. Dr. Susie Hoda is the Medical Director of Infection Prevention and Control and the Infectious Diseases Physician at the University Health Network, and they are answering your questions. Matt Demel is on the line from Summerside, PEI. Hi, Matt. Welcome to Checkup.
Hi. Thanks for having me.
You had a question?
Yes, I did. My biggest questions, I got two of them. Maybe you'll go into three. How infectious is the coronavirus in terms of like what you'd say in the medical profession? I heard something going around called R value or ARC infection value. Also, and how long do, coronavirus, infectants stay asymptomatic? Like, I know the flu sometimes can traverse between people and you show no symptoms for the first 4 or 5 days. I'd like to know if that applies to the coronavirus, and how does that apply with, flights being open and travel still being allowed?
We'll put that one to Dr. Hoda.
Sure. So great questions. The first question is one that we'd all love to have answered, and that's a question of how infectious is this actually? And so the term that you've been coming across is an R naught, and it's really kind of a coefficient that we've developed to describe how efficiently people are infected. So, if one person was infected with the virus, how many others would become infected from that person? And it's a bit of a complicated term. It's also something that's really hard to estimate early in a problem like this, because the information is changing all the time. So your values can change, and you'll see that gets adjusted quite a bit as different measures come into place to try and contain the virus as well. So I can't really answer that accurately. There are lots of numbers that have been going around, but it's just remains to be seen. Now, all the other things that you're talking about are features of the type of the infection, which include, the incubation period, which is a time from when you get exposed and infected with a virus to when you actually show symptoms. And that right now we believe is somewhere between 1 and 14 days. The majority of people in the earliest report of cases that was published actually showed symptoms within 3 to 6 days. But we do know that there have been cases that it's taken up to 14 days before they show symptoms. And how long they're actually infectious or even symptomatic after that is still a bit unknown and a bit variable. So, that's why we're following cases very closely. And our protocols here in Canada would be that we keep people isolated and in the right precautions until we don't really detect the virus from secretions in the respiratory tract. And we're comfortable with reliable testing on that.
Okay, well, thank you very much.
Matt, thank you very much for your question. Getting a version of this question that I'm about to read to you several times on our Twitter and Facebook. Kirsten on Twitter said this: how does someone limit potential exposure in large group situations like public transit?
Oh, that's a tough one. I mean, I take public transit myself, so I think about this all the time. I mean, there are some things we can do, but you are correct that we've got lots of bodies crammed in there together at the same time. So it comes down to the same basic measures. Washing your hands, buy sanitizer, that would be effective as well. So you can clean your hands, try not to hold on to those poles with your bare hands, and if you do, I always wash my hands immediately when I get home. Try not to touch your face. That's something we do subconsciously hundreds of times in a day. And that's one way that you can actually get yourself infected if you touch a contaminated surface. And then for those of us who start to feel ill, it's really important to practice what we call respiratory etiquette. So if you feel like you need to cough or sneeze, make sure that you cough or sneeze into your sleeve or into a tissue or something like that to protect others around you. And if you're feeling really sick, stay home, rest, take care of yourself, and don't expose other people. Those are the kinds of pieces of advice we have.
Caitlin Boutelier is on the line from Kelowna, BC. Hi, Caitlin. Welcome to Checkup.
Hi, thank you for having me.
Good. I understand you're a chef, so you've got a specific concern.
Yeah, well, so I see a lot of imports coming through my kitchen that come from China. It's not specific what regions of China the food comes from, but I'm curious about, I heard the questions earlier about packages coming from China, but I'm curious about food products, things that we eat. So not only produce, but things that have been frozen or maybe even meat products that could have been, this thing started in a market. So I'm wondering what the risk of contamination to edible imports that we have in Canada are.
Good question, Caitlin. I'll put that to either one of our guests.
Sure. It's actually a really interesting question. But, if you're going to take produce that's coming from elsewhere and wash it well, then any risk of contamination of that produce is eliminated right there. And I would say for other types of food substances, cooking it would also be an effective way of killing, any kind of bacteria or viruses that might be there. It would inactivate them. So, those usual measures, as long as you're following the usual food safety guidelines that we have out there, should be effective enough here.
And aside from being a chef, Caitlin, I understand you're also pregnant, and so a particular concern about the flu bug floating around.
Yes, of course. Definitely concerned about my little baby, but I also cook for seniors, so I'm concerned for them as well. Has there been much research on the virus surviving on food?
Not to my knowledge, but Dr. Hoffman might have something to say about this.
Well, first, congratulations on your pregnancy. That's very exciting.
Thank you.
I think that the good news in the Canadian context is that we actually might have the world's safest food supply system in the sense that we have a Canadian Food Inspection Agency. We have some of the most rigorous regulations anywhere in the world. And so that's great news for us. But it also, partially, that's because what makes it particularly of less worry here is because if food is cooked, or if food is washed, then the risk goes away. So in that respect, from a food perspective, if it is washed and cooked, there isn't such worries. It's a great question.
Thanks a lot for your question, Caitlin. Appreciate it.
Thank you very much.
I'm going to try to squeeze one more guest in here at the end. As much as there are concerns from the general public over the coronavirus, frontline health workers are at increased risk of contracting the virus. To talk more about that, Vicki Mckenna is on the line now. She's the president of the Ontario Nurses Association, and we've reached her in London. Hello, Vicki.
Hi there. Good evening.
Could you tell us what protections are in place for nurses and other frontline workers when it comes to this new strain of the coronavirus?
Well, first, I want to start off by saying there's hundreds of nurses working in our healthcare system who have lived experience with SARS and lived experience with other viruses, and they are on high alert, as you can well imagine. We did lose nurses during SARS, and those experiences live with those nurses in their work every day. As best we know today, particularly our hospitals are moved to action. I was speaking with our leaders at Sunnybrook, and they are feeling confident that they are prepared. However, the issue at hand, and always is good communication, not only in the province, but within employer sites, and that the employers are providing the protective gear that's required and the appropriate gear. We are hearing of some resistance in some employer sites now, and we'll be doing a review of that and connecting with our leaders as best we can. We have over 140 hospitals that we have nurses working in, as well as long-term care, primary care, which is a big concern right now in public health, and as well as clinics and industries. So we have a number of nurses out there. They will be at work. They want to do the best they can, but it's the employers and the government that need to ensure that the protective gear is there and the instructions are given clearly, so that everyone is protected. Because if they're protected, so are the other patients.
And we are at the end of the show, Vicki. But I just if you could answer this one for me, because nearly half of those infected in Canada during SARS were healthcare workers, and at that time there was some reluctance from nurses to work in SARS wards, even with double pay. Is that something that we might see again should this virus spread?
I have heard nothing of that. Part of the resistance, as you want to call it, or as some people might describe it, was actually in regard to the fact is they didn't have the proper gear. It was not supplied to them. That was their resistance. And when they are assured that they have the proper gear, the personal protective equipment, nurses, there will be no hesitation. And there isn't now. I haven't heard of any reluctance at all. But we have to ensure we have the protective gear there, that people are clearly instructed, and all the supports are in place.
Vicki Mckenna, we're going to have to leave it there. Thank you very much.
Thank you.
Vicki Mckenna is the president of the Ontario Nurses Association. We reached her in London, and I want to say thank you to our guests who have been here in studio, Dr. Susie Hoda and Professor Stephen Hoffman. We take our job seriously in terms of trying to combat some of that misinformation that's out there right now. Of course, the WHO has not yet declared this an emergency, but I thank you for answering all of our callers and listeners' questions.
Thanks for having us.
Yep, our pleasure.
Thank you very much. And that is it for this week. Thank you to everyone who called today. If you missed part of the program, you can listen again anytime online. Go to our website, cbc.ca/checkup. There you'll find our show highlights, or you can join the social media conversation, which is continuing online. Coming up on CBC Radio 1, The World This Weekend will have much more coverage of Canada's first presumptive coronavirus case. And, of course, you can also tune in to White Coat Black Art with Dr. Brian Goldman. He's going to have a special on the coronavirus as well this evening. You can email checkup@cbc.ca on Twitter and Facebook. Find us by searching for Checkup CBC. Thanks to everyone who helped this week. Our phone screeners are Shiroz Arof, Mehek Mesahar, and Julie Takeda. Technical production and editing, Yelena Yurak. Our program assistant is Ashley Fraser. Cross Country Checkup was produced this week by Richard Raycraft, Joanna Dragani, Susan McReynolds, Levi Garber, and Abby Plenner. Digital producer, Jason Vermesh. Our senior producer